So, in case of head injury, which is leading to loss of sense of smell, so what can be Ayurvedic treatment or how to go about approaching the case? Guraja sir, can you please elaborate on this case?
See, first of all, we need to evaluate and ascertain whether the injury to the which part, whether it is at the level of nose or at the level of even a higher centers, or where the cognitive centers related to the smell and all those things has been disturbed. If you go through some MRI and that type of things, and if it is required, some nerve conduction test. Of course, may not be sometimes possible with the head injuries, but usually we will go with the MRI scan and the CT scan, which is a supportive to a conclusion. When there is a loss of smell post a head injury, it is not a good sign, first of all. And we need to have a sense of smelling, and this thing should continue to be called as a human being is normal. So here, what are all the available options for a treating physician? What can be done? First thing is to establish level of Kavaigunya, where exactly the lesion has taken place or where there is a discontinuity in the no, cognitive function, the smell has been gone. So once we establish particularly this kind of thing, then we can assess whether it is possible to treat through Ayurveda or not. Then we need to go for in such a way manner that what are the Uttamanga related procedures which can definitely going to scope or help us in giving out some results. So in this thing, the therapies which are aimed at the head or Uttamanga is Shiropichu, Nasya, Shirobasti, these things. So here, before doing any Shiropichu, Nasya, Shirobasti or something like that, better we need to assess the damage. If the damage is severe or it is somewhere down the line, even the entire cognitive track where the smell is been perceived and assessed and it is been given a feedback, if any such type of damage is there, whether such things can be managed through Ayurveda, then we need to go for something which is Nadi Balya, like Danvantram 101 Nasya, or some Tarpana quality Nasyas, Shirabala 101 Nasya, or if there is any avarana which is leading to the blockage, which is leading to the sanya nasha of particularly of smell, then it is better we go for avarana bhedana type of things. So when avarana bhedana type of things are there at our disposal, it is something which is sukshma as well as it will be penetrating. So you can go for something like volatile oil containing materials like shunti rasa yukta nasya or nimba taila nasya, something like that which can be penetrative in nature. Such type of things can be used. So, but before doing all these things, it is better to ascertain and evaluate and even conclude that whether it is due to avarana, it is due to vatakshaya, or it may be some nerve damage or something like that, whether it can be done or not. At sometimes, in these type of cases, we cannot say that results will be 100%, or we cannot say result won't come. By virtue of treating, many times it becomes so obligatory for a treating physician that the patient will say that you try, sir. So in that situation also, we need to try out what are the best possible ways we can handle these. So in that situation also, we can go for this type of tarpanas and nasyas, shiropichu and basti and something like that. Of course, after ascertaining whether it is avarana janya or whether it is due to vatakshaya. So based on that, we can finalize it. If it is a nadi, something damage to that or higher center being damaged, then it is difficult to get a result. If it is in the lower down somewhere, if it is a blockage or something like that, then it can be manageable and it can be re-established. The connectivity can be re-established. Better assess all these things and then go for the procedures. Definitely, it will going to help in that sense. And of course, being nadi and vatajanya disorder and these are things, and it takes much time usually. And quite a good time in getting these results in these type of cases is at least 3 months. 90 days to 100 days is a quite good time, and at least we need to do the treatment course till that time. If by 100 days also, if you are unable to get any result, convincing result, then it is not possible to give out any result.
Sir, thank you very much there, sir. Especially if the injury happened like yesterday or today morning and the patient is brought in, ascertaining the extent of injury, doubting whether there is any internal bleeding, whether that bleeding is seeping into the brain areas leading to clot formation, all those things to ascertain that, like you said, an MRI scan or CT scan would be the priority. First thing, whether to rule out is whether there is bleeding or not. Sir?
See, in olden days, there was no such techniques were there. Maybe I don't know how our acharyas used to ascertain these type of things. Even head injuries used to occur even those times, and even pakshagata and these type of nadi aghatas and these type of things used to happen even those times. And I don't know how they used to ascertain and how they used to give results. But when we are living in 21st century, and we have at our disposal something which can be utilized, some technology is there. Why don't we utilize that? So we can go for utilizing the MRI or CT scan and such type of things, so that we can ascertain and come to a conclusion whether it is avarana janya or it is due to kshaya janya, or there is some nadi which has been totally cut or something like that. Nerve conduction test, these things will definitely will give ideas. Based after that, then we can have some sort of prediction whether at the end of the 100 days of my treatment, whether we can expect some results or not. So it is better to go for that. And usually these head injuries happened, maybe two-wheeler skid or something like that, or fallen in the house in old age people. These type of things usually will have a head injury, and in that cases when they go for a scanning and these type of things, usually they say that patient will be observation for 68 hours or 96 hours, something like that. It's very clear reason is that the situation is liquid and it is molding and it is changing every moment. So it may ultimately end up in some level. So that has to be ascertained because it's a somewhat totally fluid situation. There's, if you repeat the scan on the day 1 and day 3, there will be changes. So based on that, doing something is always difficult. So it is better, we need to understand there is a bleeding which has caused the avarana and there is something like that, or there is no bleeding, it's an infarct which has caused due to that, or a head injury has caused a concussive head injury or a non-concussive head injury. Based on those parameters, we can little bit plan out our protocol, what can be done, what exactly can be planned out. But still, in these type of cases, definitely it requires 90 days to 100 days to totally recovery or giving some good results. Beyond that, there is no meaning in trying.
Like you mentioned, the Shiropichu, Shirodhara, etc. procedures, because nowadays public information regarding health is available more freely. Everybody is worried about post-traumatic stress disorder and other things. Overall, in any case of injuries, the Vata dosha tends to aggravate. So probably with the external therapies which mitigate Vata dosha, oral medicines such as Kshirabala 101, Dharmantaram 101, and to keep the inflammation low or to heal the inflammation, Dashamula preparations, they can also be included. Can you please guide on the oral medicine strategy here, sir?
Definitely. See, when you find it out, it is a higher center which is involved and it is of Vata and it is giving trouble in the way of Vata, or in such type of conditions, if it is there, we can go for any Vata management. So when we go for the Vata management, it Shodhana and Shamana, in both the ways it should be used. So it's very clearly, if it is Vata, then internally Snehapana and all these things are whatever the protocol being laid down holds good even in this condition. And as well as internal medications like Kshirabala, as you mentioned, even Dhanvantram and such type of things, And even Dashamula containing drugs in the form of for a Svedana, if you are giving an Adi Sveda to a particular area, then putting this Churna into that. The vapors coming out of this Dashamula Kvata Churna will also be helpful, and even the Maharasnati Kvata Churna will be helpful. So something like Vata management, Vata has to be managed. So what and all the procedures can be done, they all can be incorporated in these conditions. It may be internal or it may be external. All the both the ways are it's always good.
And sir, regarding nasya therapy that you explained, that Tikshna type of nasyas, maybe neem oil that you explained, or even Lashuna Taila or garlic oil. So those are relevant only in the, say, maybe initial couple of weeks, and then we have to go for more of a soothing and vata shamana type of nasyas.
No, basic thing is that once we analyze the condition based on the symptoms, parameters, and of course the modern tools of imaging, CT scan and MRI. If you feel that it is due to avarana, then till avarana is broken, we need to go for a Tikshna type of things, and we need to ascertain like it is not due to bleeding. The internal head injury, or maybe that injury is concussive in nature, but there is no bleed, no internal bleeding. When there is no internal bleeding, then we can go for some shamana type of thing and a shamana type of thing or soothing type of thing and pacifying the vata. If there is a bleeding, initially we can't do it because once the bleeding settles down, that's why the reason that the 68 hours or 96 hours they'll take as the patient care will be kept under observation, and the situation is will be definitely fluid in nature and it will be evolving. So in that time, it is better to observe, and once there is a stagnation in the pictures of these things, repeated scans or even MRI, then better to go for something penetrative so that it opens up. Avarana can be broken. So if it is initially, if there is a bleeding, we can't go for something which is breaking up in nature or breaks open. Only thing is if it is a type of Vataja Vyadhi, how it can be pacified, in that way it can be handled initially. Once there is a stagnation and internally it becomes a repeatedly same type of changes in the areas of leak or coverage or what we call in the CT scan and something like that, then it is better that that time we can go for if it is in a bleeding as a previous cause is there or internal hemorrhage what we call it. In that condition, it is we can use it these type of penetrative things like lashuna or shunthi or something like that in the form of nasya with some soothing oils. But there is no such type of avarana, it is purely because of the vata, then it is better soothing type of oil can be used. But usually in a head injury, if there will be some concussive nature and most of the time it will be bleeding. So when there is an internal bleeding, we should be cautious in the initially. We should not cause further Ushna Tikshna Dravya should not be given to increase the bleeding, because if you increase the bleeding, then more area comes under the coverage of the disease, then more vast lakshanas will be seen. So it should be better to avoid those things in the initial when there is a bleeding.
And there's a question here. Lin Wo asks, you mentioned about Dashamula Churna vapors can help in head injuries. Is the treatment done by boiling Dashamula Churna and inhaling the steam? There is also this Dashamula Kshira Dhuma also, and probably Dashamula Taila Nasya is also an option, sir.
See, whenever we are giving a Svedhana followed by Snehana or oleation followed by fermentation, while doing fermentation simply just with the water we don't do it. We'll try to put something into the water like that. See, whenever nowadays in the Panchakarma setup, what we do is we try to put a pressure cooker which containing water in that potali is being put into that, and that potali contains the Vata Churna or Maharasnadi Vata Churna, something like that. It will be subjected for boiling, and the vapors will be directed through the nadi to the place where it is required. So if that is a condition, then it is better we can go for such type of drugs which is boiled and their vapors can be directed to the place where which is required. So by using Nadi Sweda or Bashpa Sweda, something like that. So definitely Dashamula being and Maharasnati Kvata being anti-Vata or pacifying in nature of Vata, so definitely it will be used in these conditions. It is not directly inhaling the Dashamula vapors. It is not inhaling. It is locally made to fall on the area where it is you feel there is an, for example, temporal lobe, there is an injury as per the CT scan or this one. So on the right side, on the left side, based on that, some vapors will be directed towards that, and that type of will be going to support in our way of handling these cases.
And kindly guide regarding the diagnosis of avarana in case of head injury. So, in which are the symptoms that we have to observe to know that there is blockage of channels or bleeding and clotting? Which are the symptoms which suggest only towards superficial injury? Maybe palliative measures are sufficient.
See, that's the reason I said in the beginning. I don't know how our acharyas are able to say that it is due to avarana, it is due to purely vata, without having the support of these type of presently what we have as a technique of MRI and CT scans. But presently, I do with the help of MRI and CT scan. Wherever there is a bleeding, wherever there is a bleeding, then it is definitely going to cause avarana. So I'll take this as an criteria of understanding whenever a patient of this nature comes to me for the CT scan and MRI or something like that of the brain, and I'll try to assess whether there is a bleeding or not, whether there is any infarct is there or not. If it is simply infarct inside, then it is purely obstruction in the path of vata, that is sangha. Then I can go for a penetrative thing because there is no injury to the vessel wall. But there is an internal bleeding, vessel wall is broken and the bleeding has occurred and it has been condensed into a clot and these areas have been covered like fourth ventricle is been covered or parietal area is covered or occipital area is covered. So such type of clarification whenever I get, I feel it is due to, I treat consider it as a avarana. Otherwise, just by outside observations are based on the lakshanas, it is difficult to say that it is due to avarana janya or it is purely due to vata. It cannot be done in that sense.
Yes, sir. Even the patient will be looking very perfect when he visits the doctor when there is a recent injury, and when he goes home, he may have an epileptic shock, or he may have an epileptic episode, or like the present case where the smell is blocked. So it's very difficult to guess in a OPD setup just by the present compliance.
Definitely, the presenting complaints will be a very clue to us to come to a conclusion. While asking the history, we will try to take the history in such a sense that whether the patient has lost the consciousness for a time being, whether temporarily there is a loss of consciousness was there, and patient had any bleeding from the ENT, ear, nose, throat after the head injury, that will be taken into care. This all will definitely give out a very clear idea of the nature or the sort of injury it has taken place. So based on that, then of course with the support of the CT scan and MRI pictures, definitely we can come to a conclusion whether it is a purely infarct or whether it is bleeding, internal hemorrhage is there, or any fractures are there, skull bone, or whether any concussion is there, or there is any midline shift is there or not, there is any oozing excessive intracranial fluid is there or not. So many criteria will come into play. All these things will definitely taken care while deciding the plan of treatment.